Hello everyone. I just wanted to take a few seconds of your day and review SI joints and what we're looking for when validating competencies. I've had a few competencies over the last couple of semesters here where students are not achieving Merrill's image evaluation criteria. Image evaluation criteria for the AP axial projection in Merrill states that we should see the lumbosacral junction and sacrum. We should see an open vertebral disc space between L5, S1, and both SI joints free of superimposition. I have included a couple more detailed image analysis guidelines for your review in the next slide. However, the biggest issue that I'm running into is that the pelvic or the pubic symphysis is actually superimposing the SI joints. The pubic symphysis with a degree of 30 to 35 degrees cephalic angle usually sits around the fifth sacral segment. What I am seeing, which I will show you in just a second, here are the image analysis guidelines for your review. In this projection, you will see that this is an AP axial projection with insufficient cephalic angulation where we are only angled maybe 20 to 30 degrees. Your SI joints are actually foreshortened, and the pubic symphysis is sitting too low. It's below that fifth sacral segment, and so we're not getting those nice elongated SI joints. I've not seen this as much as I've seen where we have an excessive central ray angulation, where the pubic symphysis here is actually superimposing both my SI joints. And, you know, students do remind me that they are utilizing the department protocol or the suggested Merrill central ray. And so what we explain to them is that, you know, God makes us all different, and sometimes, you know, some of us have more of a curvature in the sacrum than others. In this case, the patient would have less curvature. And so it is the student's responsibility to be able to identify this and tell the technologist that the central ray is actually excessive and I need to decrease my central ray and repeat this image because they are not meeting Merrill's image evaluation criteria. When this does occur and the student is able to accomplish a successful repeat image, you can count this as an additional image because this is patient anatomic variance, not you know, the student's fault. They utilized the appropriate central ray. However, it was just too much for that patient. I have included some oblique projections. Obviously, for the oblique projection, we're looking for an open SI joint, okay? There should be minimal overlapping of the ilium and sacrum, okay? Here's an example of this. I have included some image analysis guidelines to help clear some things up. This is just an example of excessive obliquity or insufficient, obliquity, where the patient is not rolled to the unaffected side to the degree of obliquity that is required to open that SI joint. The sacrum here is superimposing the ilium here, and we should not get that. Okay, this is considered a repeat, and the student is responsible for repeating it, whether or not it is allowed, I will mark the student as this should be as a repeat. And our last image here is just an example of extreme excessive superimposition. You can't even see any SI joint here. However, I like to look at the sacrum and see how close to the pelvic brim it is to determine if there's some excessive obliquity. If the sacrum is superimposing that pelvic brim there is excessive obliquity. So the next time that you're looking at some imaging and trying to determine if you're excessive or under rotated, look at that sacrum and see how close it is to the brim. It should be almost in line with. You can take a look back at the oblique projection and just kind of see where that sacrum and the pelvic brim lie, and you'll see what I'm talking about there. Anyhow, if there's any questions or concerns, please feel free to reach out. I just wanted to share this, like I said, so that you had an idea what we were looking for, or not even really what we're looking for, it's what we're grading the student in accordance to Merrill's to determine whether they've met the standard or not. Again, thank you all for all your time and attention.